Hi, my name is Kara. I am a registered nurse. I have been nursing for the past 14 years in a pediatric intensive care unit setting. I also am currently getting my master's in nursing education and also previously have worked in the simulation lab for nursing students at a local university. And I really wanted to come on and just make a really quick video showing off my doctor stethoscope. So this bad boy right here is the Littmann Cardiology 3. Very fancy stethoscope with all sorts of bells and whistles and all sorts of stuff that actually is broken right now. My cat ate the tip of it. Always put your stethoscope in a safe place. We actually don't use these stethoscopes anymore. We actually have stethoscopes in all the patients' bedside carts. So actually no one owns the stethoscope, which I know might be shocking, but doctors, respiratory therapists, nurse practitioners, nurses, we all use it. So it's actually not a doctor's stethoscope, I guess. But anyway, what I wanted to do real quick was just give a shout out to my Littmann Cardiology 3. What I'm holding in my hand right now, this stethoscope, it has listened to a newborn's heartbeat. It has listened for the heartbeat of a patient who is deceased, whose heart has stopped. It's listened for bowel sounds after surgery and helped determine that the patient might have an ileus, which made me contact the doctors and surgical team. This stethoscope has made me reevaluate, or I guess has allowed me to reevaluate my asthmatic patient and determine that the current course of treatment wasn't working, which made me contact the doctors. I'm from Jersey. The doctors and nurse practitioners or whoever, as well as respiratory therapy to change the patient's plan of care. It has confirmed prior to x-ray patient's endotracheal tube placement, breathing tube placement. It has found and determined that a patient could possibly have the breathing tube in the wrong place. It has been used and detected that the patient might perhaps have something like a pneumothorax. And you know what? In those cases, I was the first person to find that. And you know why? Because even though that the nurse practitioners and doctors that I work with are fantastic, and the respiratory therapists that I work with are awesome, they're not at the bedside 24/7. I am. And with this magical doctor stethoscope, I can pick up little subtle cues like that tell me that my patient needs something. I guess what I mean is, at the bottom end of the day, this is a tool. It doesn't belong to anyone. Although, actually, technically, I think it's for cardiologists. Probably don't need this. But, and I probably couldn't hear a murmur if it like jumped out and hit me on top of the head, but that's neither here nor there. I'm not just a nurse, and this is not a doctor's stethoscope. This is a nurse's stethoscope. It's my stethoscope. Thanks for listening.